On that note, I grew up the same way everyone else did. I mean, not just everyone in America, throughout history, the medical dude is just the dude who's universally pretty much respected. You see a guy in a white lab coat, you see doctor, you think this is a human being, one, obviously educated and smart and all that, but someone here to help. He's somebody here to help. And so many didn't go that route, or at least didn't seem to go that route the last 2 years, and it almost looked nefarious sometimes. Why? How did that happen?
Well, listen, Jesse, physicians are no more courageous than any other professional, and they, for the most part, just want to be left alone to do their job, to take care of their patients, and they don't want to get involved in local politics and drama. But unfortunately, politics has taken over healthcare. The institutes that we used to respect, the three-letter healthcare institutes in DC, like the CDC and the FDA and the NIH and so forth, have become political organizations as much as they have been healthcare organizations. And so healthcare has been thrust into the middle of politics. And it's unfortunate, and I hope more doctors take a stand and speak out. Listen, there were 5 doctors that signed the Declaration of Independence. Doctors have always been involved in the founding of our country and in politics, and it's time that we stand up and get involved again.
Doctor, where is the left-wing pressure coming from? I'm not in the medical field, quite obviously. I'm not smart enough to be there, but where does the left-wing pressure come from? Is it the American Medical Association? Is it the university system that's pointing these out? Is it the hospitals themselves? Where's this pressure coming from to do things that maybe you don't believe in?
It's a good question, Jesse. So first of all, the American Medical Association only represents about 15% of the doctors. Yet they come off as if they are the voice of physicians in the country, and they really aren't. Even medical schools have become quite progressive. So for example, many medical schools now have a required course on CRT, critical race theory, as if that has anything to do with medicine. So most of these medical organizations have become very, very progressive. And listen, I'm on the front lines here in Southern California. And in California, there's a bill up in the legislature right now that will sanction physicians for spreading misinformation or disinformation. Of course, that's not defined. So I think that's unconstitutional. It's anti-scientific, and it violates the doctor-patient relationship. So no longer can I say things like, I think cloth masks are ineffective in the spread of respiratory illness, because the government narrative is different, and I'm not allowed to speak against the government. I no longer can say that I think a healthy child should not receive a COVID vaccine, that the risks are greater than the benefits. But that's different than the government narrative, and I'm not allowed to say that. So California is, in effect, trying to put a gag order on all physicians not to speak against the government narrative. And I think that's very dangerous, unconstitutional, and very unhealthy and unscientific.
What kind of impact have you seen on people throughout this COVID pandemic, not just physically, but mentally? I will tell you, I see it everywhere. It seems like the mental health of the nation is in a much worse spot than it was 2 years ago.
Well, there's no question, Jesse. I saw a statistic yesterday that said there has been more deaths of people less than 65 years old due to alcohol and drug abuse than from COVID-19. Unfortunately, when these healthcare edicts come down, nobody ever asks the question, what are the consequences? And specifically with our children, the consequences of masking a small child is devastating. We've seen the highest levels of anxiety, depression, suicidal ideation, learning disorders in children directly related to the fear-mongering and the forced masking of our children. Masking our children, not only does it not help, it causes more harm than good. So I really think our COVID policies have created more problems than they've solved. And we need to stop this right away.
Okay, I know this is going to sound like too broad of a question, and maybe it is, but I'm uneducated, so I'm going to ask it anyway. How did we do that? I mean, look, I knew early on, I'm not an intelligent person, I knew throwing a mask on your kid and telling him he's going to die if he takes it off is not good for the child, so I didn't do it. I assume, obviously, many people knew as much, and yet we have institutionalized child abuse as a country for 2 years.
Yes.
How did that happen?
Well, I think it happened, Rahm Emanuel under President Obama famously said, never let an emergency go to waste. And I think that's what's happened. Under the umbrella of an emergency, the tyrants in government wanted to take more and more power. And they did so by creating fear, unnecessary fear. My podcast co-host, Dr. Mark McDonald, the psychiatrist, Informed Dissent is our podcast. He wrote a book called and talks about mass delusional psychosis that has taken over the country because legacy media has nonstop broadcast fear. Remember, early in the stages of COVID, they would have a running meter of the number of deaths, the number of cases, the number of hospitalizations, the number of ICU admissions, and so forth, purposely to instill fear. When somebody's fearful, they'll do almost anything. They'll listen to the government, and they want their fear to go away. It's almost like a Stockholm syndrome, where we come to admire our captors and ask for permission to have just a little bit more liberty. Let us go out at night. Let us go back to restaurants, etc. So this is perpetuated by these power-hungry bureaucrats and even some elected officials in my state. We've got one of the most tyrannical governors in Governor Newsom, who has maintained a state of emergency despite evidence to the contrary for the last 2 years. And that state of emergency allows him to wield ungodly powers to keep the public in fear and to keep us masked and our children masked. And now they want to vaccinate our children in order to attend school, and it goes on and on and on.
Don't miss Jesse Kelly Breaks History, The Forgotten Genocide, the first episode of a new series available now exclusively for First TV supporters. Visit the First TV app or thefirsttv.com to subscribe and start watching today.